Welcome to Marina Hills Animal Hospital, our staff meeting. Our medical moment today is going to be on hot spots. You realize we never have done hot spots. So the doctor word for a hot spot is a pyotraumatic dermatitis. Hot spot's easy to remember. There are many things that can affect the skin of dogs and cats. Hot spot is one of them. There are other things that could look sort of like a hot spot if you haven't seen them before. A bacterial skin infection could look similar. Deep bacterial infection of the hair follicles called bronchiolosis could look similar. An infection by Demodex mites that causes the hair to fall out could look similar. And on rare cases, cancer of the skin, where the hair falls out and the skin is inflamed and sad, could also look similar. That's to say, if your pet has a skin lesion, it should be examined by a doctor so we can sort out, is it a hot spot, which is easily treated, or is it something more serious, which we can determine based on physical and a few little tests. A hot spot, they're very common, more common in dense-coated dogs, sometimes in cats, more common in hot, humid weather. And essentially what's happening is the pet is irritated on their skin. They scratch or rub and they don't stop. And the irritation from scratching and rubbing leads to more irritation, and it just becomes this cycle. And within a few hours, pets can really harm themselves. The characteristic look of a hot spot is the hair is thin or missing and the skin is oozing, and it's very painful. It's oozing a serum, and unfortunately, hair then lays into these moist wounds, and hair always has bacteria in it. And so while these don't start off as infections, they start off as irritations that get over-groomed, over-scratched, rubbed. They can turn into infections if they're not cared for. So that's what a hot spot is. What can trigger them? If a dense-coated pet is not well groomed, if their hair is heavy, if their undercoat is heavy, if the hair is tangled and tugging on the skin, I think sometimes that causes irritation. Pets with ear infections will sometimes scratch at their ears and miss, and then cause abrasions on their skin, which turns into a hot spot. Similarly, pets who have anal sac inflammation or infection, sometimes they start going at their backside, they get carried away, they miss, and then they cause a hot spot. And then fleas. Fleas are a classic trigger. The irritation from a flea bite can get a pet started, they don't stop, and then they end up with a hot spot. The basic treatment, once we've identified it, is to clip the hair and clean the area. Depending on the pet, that might require sedation, because sometimes these are crazy painful. And depending on how quickly they've been discovered, sometimes it gets stinky, infected. Not right away, but within a day, they can become really smelly, painful. So sometimes sedation, definitely clip and clean. The treatment fundamentally is to reduce the inflammation, and steroids are really good at doing that. More recently, we've been using other drugs to try to minimize the use of steroids. Apoquel can be very effective at blocking the itch cycle in the skin as well. And then and astringent, so something to dry the surface of the skin and promote a scab formation. And then finally, antibiotics sometimes, often topically, occasionally systemically if we think that there's also a deeper infection component to it. The challenge, the interesting part, is to figure out what triggered it so we can avoid it happening again. And so in the case of a flea trigger, of course, flea control, sometimes just better grooming, brushing and combing, and keeping the hair coat clean and dry against the skin. If pets have underlying ear infections, addressing that. If their anal sacs are getting infected or inflamed, addressing that to minimize recurrence of the hot spot. Which medication we use depends a bit on which part of the pet is affected. Some of the topical sprays that we use would be very bad if you got them in their eyes, and so we don't do that. So again, the doctor's input is important on diagnosing, but also choosing the appropriate therapy. Which topical we'll use, is it a cream, is it a spray, and are systemic anti-inflammatories needed, are systemic antibiotics needed, and the doctor will sort all that out. Any questions about hot spots? Yeah?
What about laser therapy?
Thank you. Laser therapy, we can use our therapeutic laser to block pain and reduce inflammation. Very well said. That is a tool that we're using with our hot spots as well. That's a quick way to give pets relief. Cool. Have a great day.